So in this video, we'll take a look at the cranial fossa. Okay, so what all bones are visible there, what part of each bones are visible there, as well as the foramens and the structures passing through those foramens seen in the cranial fossa. Now for that, you have to know what the cranial fossa is and how do we view it. Okay, so we take the skull bone and we section it along this dotted line. Okay, we section it along this line and we remove the upper part. Okay, after removing the upper part, we view it from above. Okay, we'll remove all the contents inside the cranial cavity, like the brain, vessels, and all the nerves, everything. After everything is removed, whatever we see when viewed from above, okay, that is the cranial fossa. So that is basically the place where the brain sits. Okay, the cerebrum and the cerebellum, all of that will be sitting or resting on that part. That is the cranial fossa. So we'll be looking at it after sectioning it in this way from above. Okay, so that's the cranial fossa. Remember, most of the foramens and the bones are similar to those seen from the basal view or norma basalis. Okay, this is the view from below, no? That is norma basalis. Now we are looking at the inside aspect of it, which is the cranial fossa. Okay, so this cranial fossa is divided into three. Okay, the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. Now let's take a look at all the bones that are visible in these fossas, as well as which bone demarcates between the anterior and middle. Similarly, between the middle and posterior cranial fossa. We will also be taking a look at all the foramens that are visible here. Okay, so you should know that there are 12 pairs of cranial nerves, okay, that emerges from the brain. They will come out of the skull through certain foramens. We will be looking at all those foramens also. In addition to that, if any veins or arteries are passing through the foramens, we will be listing them as well. Okay, so let's take a look at the cranial fossa. From anterior to posterior, what are all the bones that are seen? The first bone here is the frontal bone. Okay, to be specific, the orbital plate of the frontal bone. That's the first bone that is visible. That is situated in the anterior cranial fossa. You can see the two dotted lines, no? That represents the line of demarcation between the anterior, middle, and the posterior cranial fossa. So in the anterior cranial fossa, the first bone is orbital plate of frontal bone. The next bone that you are looking at is called as the ethmoid bone. Now this bone has two parts that you should note here. You can see dotted, lot of foramen there. Okay, minute foramen forming a sieve-like structure. That is called as the cribriform plate. Okay, all those dots on either side. In the midline, it is elevated. It forms a elevated ridge. That is called as the crista galli. So in the ethmoid bone, you have to remember the cribriform plate, which is the dotted plate. Okay, lot of tiny foramens are there. Okay, and in the midline, you have an elevated line. That is called as crista galli. Okay, so these are the first two bones that you are seeing in the cranial fossa. The third bone is the sphenoid. Now we've been telling a number of times that the sphenoid has lesser and greater wing. Remember, the other important part of sphenoid is the body of sphenoid. It resembles a butterfly. So this is the center part of the butterfly. It has two wings, the lesser wing and the greater wing. Okay, it has a body and lesser and greater wing. Now can you tell me which part of sphenoid demarcates between the anterior and middle cranial fossa? The lesser wing. Okay, so this is the boundary formed by the lesser wing that separates the anterior and middle cranial fossa. Related to the lesser wing, okay, there is a foramen here that is called as the optic canal. Okay, related to the lesser wing, the foramen is called as optic canal. Now the next colored area that you looked at is the greater wing of sphenoid. In the norma basalis or inferior view of skull, we already saw two foramens. Okay, the anterior larger oval one was the foramen ovale, and then was the foramen spinosum. From look through the cranial fossa, you can actually see 3 foramens. Okay, out of this 3 foramen, only 2 are visible in the inferior view of skull. The other foramen that is seen in the fossa is the first one. This is called as foramen rotundum. It is round, so it is called as foramen rotundum. Okay, remember R, O and S. Foramen rotundum, foramen ovale and foramen spinosum, anterior to posterior. These are the 3 foramens that are visible in the cranial fossa in the greater wing of sphenoid. Okay, so the greater wing of sphenoid is present in which cranial fossa? In the middle cranial fossa. And then we have the body of sphenoid, which consists of all these parts. Okay, from anteriorly, you have the chiasmatic groove. Okay, so the optic nerve will form a X-shaped structure that is called as optic chiasma. Okay, that X-shaped structure will be situated in this groove. So that is called as chiasmatic groove. Optic chiasma is present in chiasmatic groove. Next we have a elevation. Now before that, on the side we have a spine-like process that is called as the anterior clinoid process. There will be 2, one on either side. That is the anterior clinoid process. Now, after the chiasmatic groove, we have a elevation. Here, this part alone is elevated. That is called as tuberculum sellae. Okay, so first there is a groove that is called as the chiasmatic groove. Immediately there is an elevation that is called as tuberculum sellae. Now, just behind that there is a fossa. Okay, that fossa is called as the hypophyseal fossa. Okay, this is where the pituitary gland is situated. Okay, in the hypophyseal fossa, the pituitary gland is situated. Okay, the next part is seen on either side of the hypophyseal fossa. Okay, here on either side. That is called as the carotid groove. Remember, the internal carotid artery will be present in this groove. Okay, so that is called as the carotid groove. Now, behind the hypophyseal fossa, again there is a elevation that is called as dorsum sellae. So, when viewed from the side, there is a groove initially that is for the optic chiasma, the chiasmatic groove. And then there is an elevation that is called as the tuberculum sellae. Again, there is a fossa, okay, that is called as the hypophyseal fossa. Behind, there is another elevation, okay, that is called as the dorsum sellae. Now, on either side of this dorsum sellae, there is 2 spinous process. They are called as the posterior clinoid process. These 2 were called as the anterior clinoid process. Okay, that was related to the tuberculum sellae. Related to the dorsum sellae is the posterior clinoid process. Now, you can see it is fully consists of, depression, elevation, again depression and elevation. A lot of ups and downs. This resembles the seat that is put on the horse. Okay, so it is called as sella turcica. Okay, this entire region is called as sella turcica. Okay, now we've looked at the sphenoid bone, its body and 2 wings, lesser and greater wing. The lesser wing demarcates the anterior and middle cranial fossa. And then we have the temporal bone. Remember, the temporal bone has a part called as the petrous part. This petrous part has a superior border. Okay, this is the superior border of the petrous part. It also has an anterior and a posterior border. This one alone is elevated. Okay, this superior border of petrous part of the temporal bone will only demarcate the middle and posterior cranial fossa. Okay, so this is the border that separates the middle and posterior cranial fossa. Okay, and this is the rest of the squamous part. Related to the petrous part, you can see a foramen here. Okay, that is called as the carotid canal. This is the other end of the carotid canal. You also saw carotid canal opening in the norma basalis. Close to that, you will see another foramen that is called as the foramen lacerum. Okay, carotid canal and foramen lacerum. On the posterior aspect, behind the superior border, you'll see another foramen here. That is called as the internal acoustic meatus. In norma lateralis, we saw the external acoustic meatus. That is the external opening for the ear. This one here is called as the internal acoustic meatus. And then we have the next bone that is called as the parietal bone. You can see two angles here. This is antero-inferior and postero-inferior angles. The next bone is the occipital bone. Okay. This region is called as the clivus. Okay. Part of the sphenoid as well as the occipital bone together is called as clivus. The brain stem sits on this part. What is brain stem? It consists of three portions of brain called as midbrain, pons and medulla oblongata. Okay. So that will rest on this part of the bone called as clivus. Okay, and the next part here you can see a foramen. Okay, on either side of the larger foramen. This is the larger foramen that is called as foramen magnum. On either side you will see a foramen that is called as the hypoglossal canal. Even on the inferior surface we saw this hypoglossal canal closely related to the occipital condyles. Okay, so this is the inner view and that is the outer view of the same canal. And close to this you have another foramen here. Okay, that foramen is called as the jugular foramen. Okay, so this is the foramen magnum. Okay, and here you can see the corresponding to external occipital protuberance and crest. On the inner aspect also there is a protuberance and crest. So this is the internal occipital crest and internal occipital protuberance. And then we have the squamous part of the occipital bone. So thereby now you can see that the entire cranial fossa is split into three. In front of this is the anterior, between this and this is the middle, and behind this is the posterior cranial fossa. And remember, the brain sits on it. The anterior cranial fossa is closely related to frontal lobe of cerebrum. So, assuming this to be the cerebrum, this is the frontal lobe, parietal lobe, the temporal and occipital lobe. Below the occipital lobe is another part called as the cerebellum. Okay, so the frontal lobe is related to the anterior cranial fossa. The temporal lobe is related to the middle cranial fossa and cerebellum is related to the posterior cranial fossa. Okay, these are parts of the cerebrum and cerebellum. Okay, so this is the relation of each of the cranial fossa with the parts of the brain, the anterior, middle and posterior cranial fossas. Now let's take a look at the foramen. I told you sieve-like lot of tiny foramens are there, no? In the cribriform plate of ethmoid. That is for the passing of the first cranial nerve, which is called as the olfactory nerve. This enters into the nasal cavity. So this is the cranial nerve that is responsible for smell, okay, through the cribriform plated ethmoid. The second cranial nerve as well as ophthalmic artery enters through this canal. What is this canal called as? Optic canal, okay, related to the lesser wing of sphenoid. What is the second cranial nerve? The optic nerve. Okay, so this is where it formed the egg-shaped structure, no, in the groove, and then it enters into the canal. Okay, so we have the optic canal through which the second cranial nerve, the optic nerve, along with the ophthalmic artery which passes through it. And then we have a fissure. Okay, this fissure is present between the two wings of sphenoid, the lesser wing and the greater wing of sphenoid. Okay, what is a fissure? It is a much larger opening. Okay, it's a much larger opening. A lot of structures passes through this fissure. Which all cranial nerves? The third, fourth and the sixth cranial nerve. All these three cranial nerves enter into the orbit and helps in movement of the eyeball. Okay, so the eyeball can move up, down. We can look to the side or the side, no? That movement is is assisted by these cranial nerves. What are the cranial nerves? Third one is called as oculomotor nerve. Fourth one is trochlear, and the sixth one is called as the abducent nerve. Okay, and what is the function of second cranial nerve? That helps in vision. That's how we are looking. Okay, so we've looked at the superior orbital fissure where these three cranial nerves passes. Remember, the fifth cranial nerve has three major branches. Okay, so it is represented as V1. V representing the Roman number 1. V1, V2 and V3. Okay, V1 is the first branch of the fifth cranial nerve. What is the name of the fifth cranial nerve? Trigeminal nerve. So V1 is the first branch of the trigeminal nerve, that is called as the ophthalmic nerve. Okay, so this is the ophthalmic nerve. Okay, it has three major branches: lacrimal, frontal and nasociliary. All these three branches of V1 passes through the superior orbital fissure. In addition to this, there is also the ophthalmic veins, superior and inferior ophthalmic veins. All of these structures passes through the superior orbital fissure that is present between the lesser and greater wing of sphenoid. The next structure is the foramen rotundum, through which the second branch of trigeminal nerve, okay, which is the maxillary nerve passes. Okay, so the maxillary nerve passes through the foramen rotundum. So this is the foramen that is visible in the greater wing only in the cranial fossa aspect. Okay, in the norma basalis you can't see the foramen rotundum. Okay, the next two foramens is foramen ovale and spinosum. In foramen ovale, remember male structures M, A, L and E. M is this one, the third branch of trigeminal nerve, which is called as the mandibular nerve. Okay, that passes. In addition to that, accessory middle meningeal artery, lesser petrosal nerve and emissary veins passes. Okay, male structure passes through foramen ovale, present in the greater wing of sphenoid. The next foramen is the foramen spinosum. Through that, nervus spinosus passes and middle meningeal artery passes. Okay, foramen spinosum, nervus spinosus and middle meningeal artery as well as vein. Okay, so these are all the structures passing through the foramen spinosum, which is once again situated in the greater wing of sphenoid. The next one is called as the foramen lacerum. No structure passes through that. Okay, there is only structures traveling above it. Okay, traversing it, not passing through it. And then we have the carotid canal, through which the internal carotid artery enters the skull. It has to supply blood to all the parts of the brain. Okay, so that enters through this foramen. Internal carotid artery. Surrounding that, sympathetic nerve plexus will be there. Okay, that also will pass through the carotid canal. And then on the posterior aspect of petrous part of temporal bone, we have the internal acoustic meatus, through which the 7th and the 8th cranial nerve passes. What is the 7th one? The facial nerve, and the 8th cranial nerve is vestibulocochlear nerve. Facial nerve is majorly responsible for all the facial expression. Vestibulocochlear is related to the ear. It helps in hearing. Okay, the cochlear part, and the vestibular part helps in maintaining the balance. Okay, so 7th facial nerve and vestibulocochlear or the 8th cranial nerve passes through internal acoustic meatus. And then we have the next foramen, that is called as the jugular foramen. The internal jugular vein will form inside the cranial cavity. Okay, it exits the skull through this foramen, through the jugular foramen, internal jugular vein. Okay. In addition to that, so far we've seen the cranial nerves till number 8. 9, 10 and 11 cranial nerve passes through the same foramen. What is the 9th cranial nerve called as? It is called as glossopharyngeal nerve. The 10th one is called as vagus and the 11th one is called as cranial accessory nerve. Okay, glossopharyngeal, vagus and cranial accessory nerve passes through the jugular foramen in addition to internal jugular vein. And then we have the next foramen through which the last cranial nerve, the 12th cranial nerve, that is the hypoglossal nerve. And the foramen is, or the canal is called as the hypoglossal canal. Okay, this one. And then we have the largest foramen in the skull, that is the foramen magnum. A list of structures passes through this foramen magnum. It is divided into an anterior aspect and a posterior aspect. In the anterior aspect, it's mostly ligaments and membranes. So there is a membrane called as membrana tectoria, two ligaments, okay, cruciate ligament and apical ligament of dens. Okay, two ligaments and one membrane passes in the anterior aspect. Okay, in the posterior aspect, all of these structure passes. What are the structures? We have the brainstem, the medulla oblongata, continuing as the spinal cord. Okay, so the end part of the medulla oblongata passes there, surrounded by three layers of meninges. What are meninges? The covering of the central nervous system. From outer to inner, it is dura mater, arachnoid and pia mater. Okay, so three layers of meninges also passes through the foramen magnum. And then we have, related to the brainstem and spinal cord, we have the anterior and posterior spinal arteries. Anterior is unpaired, only one is present. Okay, whereas posterior spinal arteries, two are seen. Okay, that will also pass along with the brainstem. We also have the vertebral artery. Now, what is vertebral artery? The contents inside the cranium. Okay, the brain and associated structures are supplied by two major arteries. One is the internal carotid artery and the second one is the vertebral artery. So, that enters through this foramen called as the foramen magnum. Also, there is sympathetic plexus. Just like how we saw around the internal carotid artery, here also around the vertebral artery, there is nerves, nerve plexus. That also passes through this foramen. So, remember, foramen magnum consists of a lot of structures passing. It is split into anterior and a posterior part. Anterior part consists of mostly membranes and ligaments. Posterior part has the brainstem, the medulla, the covering meninges, as well as nerves and veins and arteries related to it. Anterior, posterior spinal artery and vertebral artery with the surrounding plexus of nerves. All these structures pass through the foramen magnum. So, we've seen about the cranial fossa, anterior, middle and posterior, as well as the foramen present in them and the structures passing through each foramen.